So welcome back. This is Walk with the Doc, November 2018. Just a quick thing up front. Are there any veterans in the crowd? Anybody? Okay, you guys raise your hand. Well, again, thank you for what you've done. Thank you for your service. A little round of applause here, guys. I know it's just been 2 days away, but thanks. Thanks a lot. And glad you all made it back. These were the real hardy people here, so good for you. Well, Dr. Sloan, one of our electrical cardiologists, is going to talk to us about holiday heart and how that can be apropos for the Thanksgiving and Christmas time coming up real soon. So, Dr. Sloan.
I'm Stephen Sloan. I've been at Doylestown now, I think 14 years at this point, and we're going to talk about the holiday heart syndrome. And has anyone heard of it? Does anyone heard of it? So the holiday heart syndrome it's been known as a clinical entity. That is something doctors talk about forever, but it was actually in the mid-1970s, I think it was 1973, that a group of doctors sort of described a series of patients that they had been dealing with who sort of on a repetitive basis were out drinking very heavily over the weekend, and then sometime between Monday and Tuesday, they roll into the emergency room with a variety of arrhythmias. The most common arrhythmia they were wound up in the hospital with was atrial fibrillation, or AFib for short. And this term holiday heart became coined, and now we almost exclusively think about it as the acute alcohol toxicities with atrial fibrillation a day or two later. The classic description would be, a football weekend of, like a Thanksgiving with a lot of football and extra drinking, more drinking than what you're accustomed to, although often in a background of heavy alcohol consumption, and then waking up in the middle of the night on Monday or Tuesday night with the heart rapidly racing and not sure what's going on, wind up in the emergency room and they're in atrial fibrillation. All the original cases, and there were some 30 cases, within a couple of hours the patients were back to normal rhythm as the alcohol was further out of their system, and no one needed any intervention. The initial group of patients all underwent extensive evaluations. They all had heart catheterizations and echoes and additional testing, and almost none of them had any heart disease. Some subtle effects were identified that they attributed likely to alcohol. And it does bring to the point that, although we all enjoy an alcoholic drink or two, or on occasion more, it does have effects, and it can be direct early effects on the heart, and or it can be later effects on the liver. So we do want to respect the alcohol's consumption. When we talk about atrial fibrillation, I always talk to patients in the office about the modifiable risk factors for atrial fibrillation. What can I do to have less atrial fibrillation? And that's one of the goals of treatment, of course. And decreasing alcohol is always number one. It's not important for some patients. Some patients hardly drink and it's not a factor. But you'd be surprised by the number of patients where alcohol is a factor in their atrial fibrillation. What you guys are doing, something that's very important. Exercise has been found to decrease atrial fibrillation. And this was important because there was studies on marathon runners, people who ran marathon in their 20s and 30s, and when they were 50 and 60, they were having more AFib than what seemed appropriate. And people were worried that AFib might be a consequence of exercise. And so they did the opposite. They took a group of patients who had AFib, and most of them were middle-aged sedentary people or older sedentary people, and they exercised them. And they looked at their AFib very carefully before exercise and the amount of AFib after exercise. And aerobic exercise definitely decreases the frequency and burden of atrial fibrillation. So it's something you can do if you have atrial fibrillation. The third modifiable risk factor for AFib is weight reduction. We've seen as the obesity epidemic has grown, we've seen a lot more atrial fibrillation, and certainly a component of that is due to it. Now, I have seen skinny, healthy people with AFib, but on average, our AFib patients are sedentary and obese, and those are modifiable risk factors. Those are the major modifiable risk factors. Sleep apnea is another modifiable risk factor. Also important to control blood pressure. So those are the modifiable risk factors. The holiday heart is important around this time of the year because those of us that work shortly after the holidays or that long holiday weekend, we certainly see a case of holiday heart. the athlete's heart has been studied extensively. The athlete's heart, particularly, extreme things like marathon runners and ultra competitive athletes, their hearts do undergo changes. Some of those changes may be what we say deleterious or not the best things. Their heart muscles get thick, their hearts slow down, and they may be prone to some fibrosis or scarring of the heart. Overall, those findings go away when the person stops aggressive athletics, and overall the effects are felt to be way offset by the beneficial effects of exercise. But certainly the athlete's heart has been studied. Most of them are felt to be beneficial changes and adaptive changes that are good. There have been some concerns about super aggressive athletes, but most of us never reach that level, and all the data on moderate and high intensity exercise in the general population is extremely favorable towards long-term health, both for the heart, but also for the brain and for well-being. So no, there's very differences between super competitive athletes and what we do. It's an excellent question, and I recently did review an article on exactly that topic. And certainly, we all know that epidemiologic studies, when the scientists study what we call teetotalers, a group of patients who never drink any alcohol, versus people who drink 1 or 2 drinks a day, there do appear to be differences. And that's led some people to say, well, it's the alcohol that is the difference. And because the teetotalers do seem to have excess mortality compared to people who drink 1 or 2 drinks a day. But when you look at it carefully, that's not what we call a randomized controlled trial. So there's no good data that you should be drinking a glass or 2 to lower your risk. And with how easy throughout the world we slide into heavy alcohol consumption, we're not really recommending that people drink a glass or 2 for general health purposes. That said, if someone is doing it, I don't think that's unhealthy. I think that's the best statement that I have.